to Just One Thing for Parents, where we offer parents bite-sized, helpful tips for how to support their children's learning and well-being. And the great thing about this podcast is that I get to talk about such a wide range of topics and interview some really incredible experts. And today I was joined by Dr. Rebecca Chilvers, who is a clinical psychologist who works in neonatal care. For those who don't know much about neonatal care, it's a world that parents can suddenly find themselves in, which is just so challenging. Parents can feel really helpless and overwhelmed, and they have to cope with so much uncertainty. So Rebecca talks about the kind of emotional roller coaster that parents embark on, and where their role can seem really unclear in this kind of maze of medical procedures that's going on. She's just got so much wisdom to share, and I really hope it'll offer parents some perspective and solace as they navigate this really difficult time. So please listen here for my episode with Dr. Rebecca Chilvers. So Rebecca, welcome to the podcast.
Thank you very much for having me. It's great to be here.
So I wonder if you could just start by saying a little bit about what neonatal care is.
It's a term, isn't it, that not everybody knows. It's a bit of a funny one, but what we're talking about when we talk about neonatal care is the care that we provide in hospitals for babies who are born either very early, and we sometimes call it prematurity, or they're born sick and they need medical care just as soon as they're born. So that's what we mean by neonatal care. And we can have a range of neonatal care. So that also thinks about babies who might be going into intensive care, all the way through to babies who just need a little bit more help or might be coming into special care. It's a big spectrum, I guess.
It's a big spectrum. Yeah. And often unexpected, I imagine.
Absolutely. So very often unexpected. But I think actually what's really interesting is even if it is expected, it's still hard. It's still got a lot of challenges. I think we can prepare so much, but I think even then it's really difficult.
So let's jump just straight into the question, and then I'm sure we'll get to some discussion about the detail. But the question is, what is just one thing that you wish every parent navigating the challenges of neonatal care could know?
It's such an important question, and I racked my brains with this one because there's so much I'd love parents to know. I guess if you are a parent who's got a baby in neonatal care right now, I would want you to know that you are the most important person for your baby. And that might sound like a strange thing to say because as parents, we assume that would be the case. But I think that in that neonatal environment, there's so many losses that parents experience. Yeah. They have the loss of the kind of birth they might want. They have lots of parenting experiences that we take for granted. Being able to maybe hold their baby for the first time or feed their baby straight away, or all those kinds of things. And I think in that really medicalized environment where there's all the machines and all these people around your baby, lots of parents say, well, what's my role? Why am I here? What can I do? And it's so important for your baby. You are the most important person. And I like to sort of describe everybody around your baby as their medical guardians.
Oh, I love that. That's such a lovely way of thinking about it. Because I think we always see, don't you, on films and things, that the baby is handed to the parent and then off you go. And there's this separation, isn't there, immediately?
Yeah.
So it can make parents feel like, well, what is my role? what can I do?
Absolutely. And I think it's so difficult because especially when your babies are going into intensive care, you might not, as you say, you might not see them, you might not be able to touch them. That's changing a little bit in our practice, but we've still got some way to go. And then they're whisked away and they're put in an incubator. So there's lots of barriers there too that are really difficult. You can't easily access your baby. That's really hard. They've got the perspex around them. You've got people doing things with them. So yeah, it's about sort of finding that role, and that can be a real journey in itself for parents.
And I suppose, when we think about it, you think, well, this is a medical intervention. The reason they're in intensive care is because there's a whole medical engine that's going to help them with their physical health. But it's really interesting that, there's such a role for psychologists, isn't there? And I think that has really increased in recent years, hasn't it?
It absolutely has. I think when I started about 10 years ago, there was a handful of us. I remember we could all fit in one small room for meetings. And now we have about 150 range of psychological professionals, I guess, working because I think we really understand the impact. And I like to think about, if we keep the baby right at the centre, what we're trying to do as psychologists is think about the baby. And yes, think about their medical well-being, but also think about them as a little person who's in this quite scary, massively sensory overwhelming environment, having lots of procedures, separated from their parents. So we're trying to think about their well-being. And then if you think about it as a nested circle around them, we're trying to look after parents so that they feel in a position to be able to provide that kind of soothing and attunement to their baby and to be there for them. And then around that, we look after the staff so that they can help parents to be able to do that for their baby. So it's sort of concentric circles. And I guess that for me is one of the really exciting things about our role in a neonatal unit is we're thinking about all those layers of the system, but keeping the baby right in the middle.
So you say that parents are really important. That's the thing you want parents to know. But what can they actually do? How can they feel like they're helping and feel purposeful in their role as a mum?
In so many ways.
Mum and dad, I should just say.
Mum and dad. And I think that's important. Any parent, families are made up so differently, aren't they? But I think anyone who comes in that kind of caregiving position, and siblings too, actually, what we want to say is there's lots you can do, and that will change as your baby gets more well. So when they're really maybe critically unwell, you might be thinking about how can you provide a safe kind of containing presence for them. And that might be something like just simply resting your hand on them, or you might be holding their little finger. And that might not feel like a lot, but actually that they know that you're there, that later on when they grow up, you can say that I was with you, I would offer that. You can see them through painful procedures, you can work with your team so that they, sometimes they have to have quite a lot of jabbing and things moving around that's uncomfortable. And actually you can learn with the nurse who's looking after your baby how to soothe them. And that might be something about, talking to them and then be able to hear your voice. And to if you can hold them skin to skin, holding, we know really helps with baby stress responses. I mean, hugely. Because as a parent, you are their environment. So actually being on you really, really helps them. It really helps them to regulate all sorts of things and to feel safe and contained. So it looks really different. And I think this is one of the things that can be really hard to what we sort of think about in terms of parenting a little baby. We're not able to do all sorts of things, but actually what you can do is equally important. All those things important.
And what you're saying is you are the most important person for your baby. What are some of the complicated kind of emotions and things that come up for parents at this time?
I mean, it's a whole landscape. I think it's fair to say that most parents I've spoken to just describe it as if they've fallen through a trapdoor into a completely different world. And I think in that world, it comes almost every emotion. I think in a sense, every emotion of the human state you can find in neonatal care, and I like to think about it as you go right from joy and, love and all these wonderful feelings that you have to real terror and desperation and hopelessness and everything in between. So I think for parents, in terms of their experience as an individual, we've got lots of people coming from having had quite traumatic births, coming into this really difficult environment in shock, not expecting it, as you said. I've lost count of the number of parents I speak to. So we were just having a lovely dinner, we were out at the theatre, and all parents who've been, I work in London, you're coming to visit as a tourist from a different country, and suddenly the baby arrives. So there is this shock and this suddenness about your role, because if you think about it, that process of matrescence when you're pregnant, part of that is the psychological preparation for becoming a parent, and that there's all sorts of things going on that allow you to do that, and you've got sort of preparation and nesting and so on, and you've got a bit of time to think about the way that your role is changing. When your baby comes really early, you may be just over halfway through that pregnancy. Wow. And they're there. So I think one of the things that lots of parents worry about and sometimes feel guilty about or feel shameful about is I don't feel like a parent, or I don't feel kind of connected emotionally to my baby. But actually, it's not surprising when you've got so many different barriers. You've got a baby that doesn't necessarily look like you imagine a baby does, because when they're very tiny, they look really different. And you've got this other layer of feeling very fearful and very much in your kind of threat system, which is also a bit of a barrier to that part of us that in our more sort of soothe state helps us bond and relate to people. So all that's in the mix. And I would say that you know, it's so much to hold. I think, you know, it's not to ever underestimate the magnitude of that for anyone, whether their baby's coming into the unit for 6 months or 2 days as well. You know, there's some sort of unspoken hierarchy sometimes, you know, that should be fine because I've only been there a week. But actually that's not helpful to make the comparison. Like, every experience is unique, and I think people struggle and a lot sometimes with maybe being there for a few days as well as a long time.
It makes me think about the, you know, really complicated emotions like guilt and loneliness, and also uncertainty.
Absolutely. I mean, you've hit the nail on the head. And we're not wired for uncertainty, are we? I mean, we're not wired as people. Our brains aren't wired for that. And I think you're absolutely right that one of the real challenges is this constant and chronic uncertainty for many. And I think, you know, we can maybe do it for a little while, often, you know, in life, with the knowledge that certainty will come of some sort. And yet, for many parents in neonatal care, they are facing months of not quite knowing. And I think that uncertainty for me also has a number of layers to it. If we sort of take the next layer off, there's something about, you know, uncertainty about survival, perhaps at the beginning, which is a particular type of uncertainty. And then that particular question may no longer be a question. So that uncertainty is set aside, but then there might be another uncertainty about, well, what's the long-term outcome for my baby?
Yeah.
So when you're going through it, it's almost like you're navigating all these different sort of intensities of uncertainty, but also very different types about different things. So it's a huge task, and I think it's a real challenge. And I think, like you said, that some other emotions that very much to the fore, a huge sense of responsibility can come up to, you know, what did I do? Could I have done something differently? And I think that can weigh on parents quite a bit.
Yeah. So we've got short episodes in this podcast. I feel like I could talk to you for so long, but I feel like we should just pull things together a little bit. And in the context of this uncertainty, what you're saying is, if there's one message you could get across to parents who find themselves in this situation, know that you are the most important person for your baby.
Absolutely.
And
and I would say, and I would add to that, focus on what you can do.
Yes.
Because you're in an environment where there's lots you can't do yet. And yet is a very important word in this, because you will be able to focus on what you can do, talk to your team, ask people around you to help you. You know, if things feel confusing, if you're not sure what the next move is, if you don't know how to do something with your baby, let them know, because they will help you. I think it's really important. And I think also related to that, whilst there are things you can't do yet, the values you have as a parent, you know, what's important to you, they hold true wherever you are, you know. So I think it's actually drilling back to those as well and saying, you know, what really matters to me. And that might be that I don't want to ever, you know, feel for my baby to feel that they're alone, or I really value being a supportive parent, or whatever it is look for ways to do that in the situation that you're in, and you will find them.
Yeah.
Wow.
Oh, Rebecca, thank you so much. I think it's just amazing that we're really recognizing the whole psychological aspect and layer to this experience. And there are people like you around who are guiding that, and those services are growing. So thank you so much for joining me today.
Thank you. That's been great.